reasons that you can actually get dark circles under the eyes, everything from fatigue to kidney problems or rhinitis. We looked at that, or you might just be born with it for that matter. So we'll get a look at some of the answers behind this and also the treatment options that are out there with Dr. Hong Young-ho joining us from G Clinic Aesthetic Medicine. Good morning.
Good morning. Welcome to our show.
Good morning.
So as we saw in the report, there are various factors that can cause the dark rings under your eyes, but many people say that you get them when you are tired. So does this have anything to do with the amount of sleep you get?
Studies have shown that poor sleep leads to poor skin condition. There's something called the autonomic nervous system in our body, and it controls the blood and body fluid circulation. And if you don't get good sleep and good rest, it can interfere with the system, which leads to swollen or discoloration or sunken look under the eyes. The skin around the eyes is actually very thin compared to other parts of the body. So it's more vulnerable to the outside environment, such as dry weather or cold weather. And of course, the internal conditions such as fatigue, stress, and lack of sleep.
That explains a lot, these dark rings under my eyes.
Use the eye cream.
And we looked at some of the non-surgical methods, including the fillers and also the laser treatments. Can you see some improvements after just one procedure? And what are some of the things that you need to keep in mind after getting the treatment?
If the dark circles are a result of decreased fat tissue around the eye area, we can reinforce it with injectable dermal fillers, which is actually a very simple procedure, and it only takes about 10 to 15 minutes. Okay, and it takes about a few days for the little swelling to go away.
So you don't have to really worry about it causing you to stay home from work or anything like that for long periods of time. But there are laser treatments and also the fillers that we were talking about that you can actually see results after just one application or one treatment, right? But what if you have a severe case? I mean, how do you know if you actually need to get invasive surgery for this instead of just regular fillers?
Those who need somewhat more invasive surgical procedures are those patients whose dark circles are due to bulging of the fat pad under the eyes due to fat accumulation and loss of skin tension. This is more common in middle-aged women and middle-aged men, and the surgical fat removal or surgical rearrangement of the fat under the eyes is necessary for those.
Okay. Well, what about home remedies? We've seen or we've heard of people saying that putting salmon around your eyes. I don't know. I've heard this from someone, really. But anyhow, home remedies like that. Salmon, for example, does it really work or have any effect at all?
Patching your eye under the eye skin with raw salmon, I'm not too sure about that. There's a metabolite called astaxanthin, which is found in lobsters and shrimps, and indeed in salmon. And it has some good effects in our body to fight fatigue and relieve pain, and it's also good for skin protection. I think the idea came from there.
Okay.
But you would have to ingest it rather than putting it onto your face.
Okay, so don't put it on your face, eat the salmon, right? Okay, that makes sense. I think it's more useful that way.
Right. And apart from the foods that you recommended or you talked about, what are some of the other tips that we can use at home? Perhaps the massage or like a cooling thing?
Yeah, we can always make use of warm towels and your fingers just to simply dab the skin around your eyes to promote better blood circulation.
Can you maybe show us some of the key points?
Just simply dabbing.
Just around the eye
Not too
area.
much rubbing it.
Okay.
Okay. And it promotes better blood circulation. And we could make use of some of the products such as facial masks or eye masks to give moisture to the skin.
Okay, so moisturize, massage, and heat up a little bit and take care of your eyes. Get plenty of rest, and if you have rhinitis, get that treated too. Salmon, eat the salmon.
Eat the salmon. Don't apply the salmon onto your skin.
Dr. Hong, thank you so much for joining us on this.
Thank you.